Hello, everyone. My name is Joan Barrett, and I'm the Executive Director of the Lakes Area Community Coalition. And I am so excited to be with you tonight, along with our team from the Walled Lake Consolidated School District Parenting Fair Committee. We work in conjunction to put on this series of weekly webinars for parents. And we are calling them Wellness Wednesdays, and we are focusing on academic wellness, physical wellness, and social and emotional wellness for your kids and for your family. So we're really excited to be with you tonight. And a couple quick things, just so you know how this evening is going to work. We are going to be recording tonight's session, and our conversation tonight will live over on the Lakes Area Community Coalition website under the Wellness Wednesday tab, and that's at lakesareacc.org. Under Wellness Wednesdays. And so our recordings will be available for you to watch later or to share with a friend or a family member if you so desire. So we hope you check it out later. For those of you who might know someone who might be interested in this conversation but couldn't make it tonight. So there will be time at the end of our conversation for any questions that you may have. And if you do have questions, down at the bottom of your screen, there is two little bubbles that say Q&A. So if you have any questions, pop one in there, and I will bring those up with our presenter at the end of our session this evening. So we are going to get started, and we're about 30 minutes. We should be wrapping up by 7, so we hope you can stick around with us and enjoy our conversation tonight. Tonight, our guest is Dr. Brian Gendelman. He is a pediatrician at Edgewood Center Pediatrics. Many of you probably know Dr. Gendelman. He has an extremely big and active practice in Commerce, and a lot of you may have spent years with Dr. Gendelman with your children. So we're really excited that he's able to join us today, and happy to have him here to talk a little bit about how your child may be exhibiting symptoms of ADD or anxiety and what that might look like. So Dr. Gendelman, welcome.
Hi, thanks, Joan. I'm honored to be here to be part of the Wellness Wednesdays for Walled Lake School District. Hosted in collaboration with the Lakes Area Community Coalition, which we know focuses on building a healthy, vibrant, drug-free community. So as you stated, I've been in practice for 30 years, pediatrician in Commerce. I also have 5 children who have tried me true for the last 26 years. So that experience is invaluable in speaking to you guys tonight. So a complicated topic and something that comes up all the time is ADD, ADHD, school problems, and comorbidities, specifically anxiety. So I thought what I would try to do tonight is help create a pathway for parents that can help lead to navigating through the sea of these disorders, and perhaps giving parents resources to gain some answers that might help them for this process. So first of all, where would the concerns come from? Where do concerns for ADHD come from? Most of the time, it's going to come from the parents, or it's going to come from the school. Parents will notice that their kids are struggling and have issues. They may acknowledge it, they may ignore it. As time goes on, life takes care of itself. We're very busy. We have to worry about getting ourselves dressed, go to work, put food on the table. And Johnny, who may be 7, 8 years old, may be struggling in school or struggling at home, and we may not even know what's going on, and we put it to the back burner. I think with COVID, that's opened up our eyes a lot, because all of a sudden Johnny's in our home 168 hours a week, and we're forced to address whatever situations are going on. So parents are the first observers of some issues with their children, and they may or may not acknowledge it right away. The school is absolutely important in acknowledging some issues. The teachers who have a classroom of many children can obviously identify outliers, children that are struggling, and hopefully bring it to the parents' attention. This could be manifest as an academic issue, a social or behavioral issue. Teachers are very experienced at recognizing children, especially in the age group that they're teaching. So I think the concerns can come from both the parents or from the school. So now the question is, how do we create access care? How do we get care to help our children who we know are struggling? So the first thing I thought I would discuss is just a definition of what ADD or ADHD is. And because that's kind of a catch-all term that a lot of people talk about, and every kid who's got a problem seems to get diagnosed with ADHD. I hear parents talk about, which really isn't true. But let's start with a simple definition. What is ADHD? It's a neurological disorder. And to the best of our understanding, it has to do with neurotransmitters, which are little chemicals in our body that don't work quite as well in some people's brains as others. That leads to poor attention, poor focus, and increased activity. Now, it seems to be about 8 to 12% of the population, which is pretty high. And a lot of parents, when we hear that, thinking, well, that didn't occur 30, 40, 50 years ago. It really did, but it wasn't picked up upon. It was ignored. I love it when I have a father in the room saying, my father used to just roll up a newspaper and hit me on the head. And that was the way they took care of his behavioral issue. That's true. But they didn't have access to care. They didn't have an understanding or a knowledge that we have today. So there are 3 symptoms that we look for with ADHD. One is obviously poor focus. And again, parents will often look at each other and say, well, I don't understand. My 7-year-old, my 10-year-old, my 12-year-old can certainly focus on Xbox for 6, 7, 8, 12 hours if I let him, but he can't focus for 30 minutes on his reading and writing and get his homework done? I don't understand. This isn't a neurological issue. This is a behavioral issue. Let's get the newspaper and whack him on the head. It actually is a neurological issue, and there's all kinds of studies that show that the poor focus has to do with work and things that we need to do. The second part of the diagnosis is impulsivity, flipping from one thing to the other. My favorite analogy of this is if you're sitting at a dinner table with a family and one person constantly is interrupting and blurting things out. You're having a conversation on topic A and all of a sudden someone blurts out topic B and is totally off topic from what we were talking about. That can be quite annoying. I go to a summer camp every year and I get to spend time with my family. And I remember one summer, my youngest son, who was about 10 years old, comes up to me and says, well, there's George over there. He's going to be with us and we don't really like George. Well, why don't we like George? Well, George comes running up to me and says hi to my son, hi to me, ask me if we can go fishing, ask me if we can go there and do this and do this and do that. And before I could even see straight, my head was spinning and I can see that George has severe ADHD untreated. And people don't like him because his impulsivity makes him unlikable. Now, I will tell you, there's a good outcome to George's story. We did spend some time together and we wound up actually treating George. And by the end of the week, believe it or not, my son came up to me and said, what did you do to George? We like him now. He's nice. Can you imagine going through life as a 7, 8, 10-year-old where people don't like you and you don't know why? So poor focus, impulsivity, and then the third piece is hyperactivity. And not everybody has hyperactivity, and there is some gender specifics here where the younger boys tend to have the hyperactivity and some of the girls do not, but that is not perfect. That can flow back and forth. All 3 of these things, the poor focus, the impulsivity, the hyperactivity, can all affect cognition, processing and learning, academics, emotional, and our social lives. The definition also requires that it occurs in 2 settings, so it must occur both at school or at home. Why 2 settings? Well, what if there's challenges in one of the 2 settings? Is that really a diagnosis of ADD? And just to make it really simple, what if dad lost his job and there's no food on the table and the kid comes to school and is unfocused? Clearly, that's not ADD. There's something else going on. So you have to see it in 2 settings. And the true definition is that it must occur before the age of 12. I'll often get people come to see me at 15, 16, 18, telling me they have ADD and we need to treat them. They're right. And the only reason I know they're right is I used to see them when they were 5, 6, 7, 8. And I usually bring this up and I get poo-pooed. We don't want to talk about that. So it can be diagnosed after the age of 12, but it had to occur before the age of 12. So I think that's really important. I thought that I would take a second and just read some criteria, and it might be a little less scientific and maybe more to home for parents. So if you're thinking your kid might have poor attention or ADHD, doctors might do some questionnaires looking for some specific buzzwords. And I'm just going to read these to you because I think it's worth a minute of your time to understand. And if this triggers something in your about your child, then you can maybe do something about it. So does your child not pay close attention to details or makes careless mistakes. If I used to do that, I'd rush through the test and get it done right away. Loses focus during activities when following instructions. Turn to page 21, read paragraph 2, go. What'd you say? Does not listen when spoken to directly. Now that can be from other reasons like anxiety, which we'll get into. Has difficulty getting organized. That's still me to this day, by the way. My desk is a mess, but it's organized here. Avoids or dislikes tasks that require sustained concentration. If they have to sit there and write a paper, they might sit for 5 minutes, move up, walk around, sit back down. They can't sit for 20, 30, 40 minutes, an hour and get the job done. Loses things. My 17-year-old has lost his wallet 3 times. Yes, there's some ADD going on there. Becomes easily distracted, is forgetful. Now, any one of these symptoms isn't ADD, but altogether, a preponderance of these symptoms can lead to a diagnosis of attention deficit disorder. So, what are the causes of ADD? What are the causes of, I just want to double check our timing, that's all. So, we went through the neurological, okay? I kind of gave you that it is a neurological disorder of neurotransmitters that are not in enough supply to focus on, to cause focus and concentration. Other than that, we don't really understand that. And the chemicals and the medicines that we use replace the neurotransmitters, and we know that that works. We know that works by observation over time. Genes play a huge role in this. There's a huge hereditary predisposition. Oftentimes I will diagnose parents, sorry dads, it's often the dads after the fact, and siblings later, and it can run in families. And then I'll hear from, oh, well, Uncle Joe had this and Uncle John had that. And maybe somebody was into substance abuses because they had ADD, had bad self-esteem because they didn't do well in school and went down a challenging path and therefore wound up maybe in and out of some drug rehab centers or had difficulty maintaining jobs. So genetics is a huge, huge red flag and lets me know that we have to consider this diagnosis seriously. Head injuries. You could have somebody who does not have ADHD have a significant head injury and then have attention and behavioral issues afterwards. So a head injury can do it, and that's part of the history that we'll often take. Prematurity, small babies sometimes have issues with their brain and their development. And then a really important one would be prenatal exposures to toxins. And that's a nice way of saying, yes, there can be toxins in the community, but really what I'm talking about is alcohol, nicotine. Sorry, my doggie is focusing on something. And cocaine. Cocaine is known to cause poor function or poor concentration and focus in older children. So truly prenatal exposures to these substances can lead to kids not focusing later in life. So when a patient comes in to my office and the chief complaint is a school problem, now that's not necessarily what people are saying to me. They might be saying to me that he can't focus, he can't concentrate, he's got behavioral issues, but I put down school problem, social problem, behavioral problem, and I write it on the paper on the table that they're sitting on, and then I put 4 categories down because I need to try to figure out what's going on with this kid. Now, just to be clear, I'm not the only one that helps take care of these kids. Psychologists, social workers, counselors, they're all doing the same thing that I'm trying to do. I'm trying to do it from a medical standpoint. They're doing it from a psychological, but it's really imperative that we work together. But if they're seeing me, I'm going to be looking for these particular things that I'm going to go through, and I may need help from the psychologist to help with that. So first of all, I use learning disabilities as my first category. Children who struggle with learning can present with poor focus and concentration and can be labeled ADD or ADHD, but has nothing to do with it. They have a learning disability. So let's talk about some simple stuff first. I lump in high IQ individuals, very successful people, as a learning disability. Why? If you've got 140 IQ, and that just implies the normal IQ is 90 to 105, that's just a gestalt. Super smart person, 2nd grade, open up the book and do 15 adding and subtracting problems, but that kid's ready to do long division. He's bored, she's bored. That's a school problem. They all of a sudden lose attention, lose focus, start talking to Johnny, talking to Sarah, and all of a sudden the classroom is in disarray because this kid lost focus and concentration. Oh my God, he's got ADHD. No, he's brilliant and needs to be challenged. Now, the opposite is also true. There are cognitive impairments. There are children that struggle and can't quite get it when the teacher teaches it to them 1, 2, 3 times. Now, the school district knows you've got 25, 35 kids in a classroom. You can't always give individual attention on that day to those individuals. And those kids need to be identified and need tutoring and special help, and they'll do fine. But if they don't get the special help, they could be school problems, behavioral problems, focusing problems, and get misdiagnosed. One of the other learning disabilities that goes undetected quite a lot is dyslexia. And I spend a lot of time on dyslexia when I'm talking to a lot of my medical students and residents, because I still don't quite get the comprehension of what dyslexia is. But the way I try to understand dyslexia is a processing disorder. What does that mean? If I look at all of you and say 2 + 2 is 4, and you in your brain heard me and you register it, and then 5 minutes later I ask you what 2 + 2 is, you say 4. But if somewhere along the line, the process couldn't get imprinted in your brain, understood, memorized, and said out to me again, you failed. And that's the way I interpret dyslexia. You're not stupid, you're not cognitively impaired, you're not ADD, but you have a learning issue, and it's mostly with words and writing, and that takes special tutors, and it can absolutely be worked on, and it doesn't get a pill to fix. The next category is behavioral and emotional problems. This can be either environmental or genetic. Genetic, again, are there other things going on with these individuals? The big thing here will be anxiety, and we're going to talk about that in a minute, but I want to spend a couple more minutes on the rest of this. Environmental, within a behavioral and emotional problem, if the environment that the child lives in is challenging, they can act out, be perceived as having a school problem, and get dubbed poor focus, concentration, ADD. But again, simple. If there's no food in the house, if dad lost his job, if there's a divorce, if there's disarray in the family, it can cause a school problem, and it has nothing to do with focus and concentration or medication. It does have to do with focus and concentration, but it's not ADD that needs medicine. The child needs some resources in the help in the home. I will tell you, I have a special story that I often tell about myself. I got remarried 13 years ago. We have 5 children, and my wife, God bless her, is smarter than I'll ever be, but we often disagree. And our children were between the ages of 3 and 14 when we got married, and they did their darndest to split us apart and cause us all kinds of aggravation. So we had a quarter that we put in the pantry, and we used to get up, because when we were like first married, we would kiss, and they'd say, get out of here, go in the pantry and kiss, whatever. After 6 months, that died, right? They would look at me, and my wife would look at me with daggers in her eyes and say, well, we just need to agree. And I said, let's go have a pantry kiss. Well, I don't want a pantry kiss. We would go have a pantry kiss, although we would get in the pantry, stay far away, get the quarter, flip it, you're right today, and we would come out with a joint force. And by having that joint force, we were able to parent better and decrease the poor environment that we were going to create for our children. Next category is neurological. Neurological can be seizures. Kids can have petit mal epilepsy, which is a rare kind of seizure where they stare off into space. You have to really think about that and talk about it with the doctor. It's not staring off into space in April when they're looking out the window when the flowers are blooming. That's different. Okay, these little micro seizures. Imagine I'm talking to you and you're hearing only every third word. You're not going to understand what I'm saying. So that's what these kids will be experiencing. And you have to have an index of suspicion. You do a brainwave test, and then you go from there. And you can treat it with medication. Other neurological conditions, simple stuff, Down syndrome, issues in development from fetal alcohol syndrome, autism. These are special neurological conditions that can lead to poor focus. They might need to be treated with medication like ADD, but the primary issue is not ADHD. So once I take a history, I'm looking for learning disabilities, behavioral emotional problems, family issues, genetic issues, neurological issues. If I don't find any of that, I can jump to a diagnosis of inattentive or attentive ADHD or hyperactive ADHD, and then I can start talking about a treatment and create a treatment plan for parents. Before I go into that treatment plan, though, I would like to spend a word on anxiety. Anxiety, we all know what anxiety is. It's an emotional, unpleasant state of inner turmoil. We're not happy. Something's causing us to be nervous, to be upset. It often will manifest itself in children in irritability, anger. You'll think they're bad kids, but really they're just anxious. It can manifest itself with stomach pains, headaches. I don't want to go to school because I have a problem. It's a physical problem. So it can present in many different ways, but all of these issues can be perceived as inattentive. So inattention and anxiety is related to the worry and rumination that kids have. And I will tell you, I'm guilty of misdiagnosing kids with ADHD who had anxiety over the years. And one of the things I'm going to end this with in a little bit is this is a process. This isn't I have an ear infection, here's an antibiotic, I'm done. When you make a diagnosis of ADHD, ADD, anxiety, it is a lifelong management issue. Not always medicine, but always going to be some sort of management. So anxiety in its own right can be misdiagnosed as poor, can present as inattention and misdiagnosed as ADHD. Now, treatment. The treatment in my mind for all of this encompasses a multidisciplinary approach. What does that mean? It means we need a lot of people. We need, okay, maybe you need me, maybe you don't. A doctor, a primary care doctor, a psychiatrist. You need your teachers. You need your entire academic system, because you need the teachers who have their support from their administrators or special ed teachers. You've got counselors, PhD therapists within the school district. We need private counselors. And I use that term because there are so many disciplines, from coaches, counselors, social workers, masters of psychology, PhD of psychology. Everybody who has that kind of professional degree can help take care of kids with ADHD, anxiety, and help them with the stresses that this stuff can cause. Okay, I am so sorry, but the dog wants to play and I'm taking the toy away now. So the other thing that then comes to my fruition is, do I start these children on medication? Who needs medication and who doesn't? I will work in conjunction with parents, psychologists, counselors. And then when I get to a point where I believe that we really are not making any headway or progress, we do typically use medications. ADD, ADHD requires, in most cases, medication to help. Stimulant medications are the mainstay. There's Ritalin, there's Adderall, and there's so many different categories of this. There's 4-hour, 6-hour, 8-hour, 12-hour. That's where you need an experienced clinician who's done this a lot to help dice out what your child needs. Children who have anxiety often need and require medication as well. There's counseling, there's therapy, and that helps. But if the anxiety is overwhelming and is interfering with them on a daily basis, then they have no choice. We have no choice sometimes to put them on medication. I am so sorry, everybody. The dog is going crazy and there's nobody home to be with the dog but me. So I apologize. So in conclusion, Joan, the treatment is multifactorial. This is real life, right? This is my distraction. I'm sorry. But the treatment is multifactorial. We need teachers, we need counselors, and yes, occasionally we need a medical professional to help with medications. So with that, I think I'll end and see if you have any questions.
Thank you. Thank you so much, Dr. Gendelman. And of course, we forgive your adorable dog. This is our Zoom world. This is what we are all living with. So
sorry about that, but he is what he is.
He is what he is, and we love it. That's great. Couple questions that I have for you, a couple questions that came up. For kids that ultimately do require medication to treat either the anxiety or the attention issues, does that put them at higher risk of drug addiction down the road? And talk to us a little bit about managing medication for young people, in children and teens.
Yeah, that's a really good question, Joan. So there are studies that actually show that if you medicate children, there's less risk of addiction later in life than if you don't medicate the children. Okay. And think about this. If you've got a problem, if you've got an ADHD kid, if you've got an anxiety kid, and they're not getting the proper help they're getting, they're constantly having low self-esteem because they're not being successful. Okay. I'm not as good as my friend in class. I'm getting in trouble. So now I have low self-esteem. As I go through adolescence, I have low self-worth. What am I going to do? I self-medicate. So it's actually the opposite. Putting kids on medication in for the right reasons, the right diagnosis, actually lowers the risk of substance abuse in our communities.
When a child takes medication, is it something they have to take every day for the rest of their life? How can parents and young people understand if and when and how the medication is being effective, and maybe if it's time to try going off the medication?
So again, a good question. It depends on the condition. If we're talking about anxiety, those medications have to be taken on a regular basis. Okay, it's not a start-stop. It doesn't work if you start and stop. ADD medications can be taken start-stop. If the primary problem is an academic issue, taking a Ritalin or an Adderall or a derivative for focus and concentration only is great, off on Saturdays and Sundays. If the family milieu, if the discourse in the family is challenging, and the child does better and the family does better on the medication Saturdays and Sundays, then it should be 7 days a week. So I guess in that case, it's very individualized. And it has to be, again, worked very closely with the doctors, the psychologists, counselors to help answer those questions for the individual patient.
Talk to me a little bit about medication safety in the home, since we are just sort of talking about medication. What are things that parents need to remember about keeping meds safe in the home, and at what point can kids medicate themselves?
So I still think that that's 18 and older. I think it's our job as parents to keep our kids safe. I mean, not that every kid is doing this, but when I have an interview in the office of a new ADD adolescent, I will often ask those kids, hey, have you tried someone else's Ritalin? Have you tried someone else's Adderall? And guess what the answer is? More often than not, it's yes. So I'm not blaming anybody, but if the parents do take the responsibility of keeping the medication under lock and key and dispensing it for themselves, I think that's the best way to do it. I mean, yes, there can be overdoses, usually they're intentional, and hopefully we're aware of those situations from a psychological mental health perspective. But in my mind, under 18, it's our obligation as parents to dole out the medication and keep it safe. On the flip side, I do have kids that go off to college and take the medication, and I have them raise their hand and swear to God on the Bible that they're not going to share their medication with other people. Now, where does that get me? I don't know, but I do tell them if I'm going to find out they're doing it or misusing it, they're not getting any more medicine from me.
Yeah, and it sounds like that's an important conversation and skill set for parents to work on developing with their child as they get ready to leave home or as they grow. Safe and appropriate self-administration of medication and keeping those meds safe around their friends.
It's a big part of the conversation we have at the summer checkup before kids go off to college. Big part.
Yeah. Appreciate that. One last question for you in reference to anxiety. Are you seeing more young people with anxiety coming through your practice right now and since COVID?
Yeah, well, that's a huge yes. And I would say anxiety was on the increase anyway. In the last 10 years, we've seen more and more kids, struggling, more families struggling. In the last year, it's, I would say, quadrupled. And I struggle with all my resources and friends who are counselors and social workers and therapists to get people in. And they've been doing a great job of accommodating the kids that are truly in trouble. But we're doing a lot of work with counseling of children, talking them through, perhaps medicating them where it's necessary. So the answer is absolutely yes. And I'm hoping that as COVID subsides, so does our anxieties.
Yeah. Dr. Gendelman, I'm so thankful that you had this time to spend with us today. We see as parents, we see our pediatrician in the office for just such a short period of time in connection with a specific issue with our child. And it's such a treat to be able to spend a half an hour and really understand your perspective and your thinking and how you go through diagnosing ADD, ADHD, and anxiety in kids. So we're really grateful that you were able to spend the time with us tonight.
My pleasure.
Thank you so much. And just a reminder to everyone, this recording will be available over at lakesareacc.org under the Wellness Wednesdays tab. And please feel free to check us out over there and share it with your friends and family members. On behalf of the Walled Lake Consolidated School District Parenting Fair team and the Lakes Area Community Coalition, I want to thank you for joining us for tonight's Wellness Wednesday with Dr. Brian Gendelman. Thank you. Have a good night.
Be well.